So as I said, we're gonna record today's session. I'd like to welcome everyone today. We're really excited about today's session, and just to start with the statement that we really want this to be interactive and an opportunity for all of the attendees to ask their specific questions about faculty positions. As a setup to what we're doing today and what we're going to talk about, this was an idea that I approached Karen Sobel and Lindsay Hamilton about a while back, because I realized that oftentimes, even though we are in academia and we're trained in academic labs and we work with faculty all the time, we don't ever really talk about what does that really mean? What is that career? And what are all of the different options that are available to somebody who may want to stay in an academic environment, but may or may not be interested in being the PI of their own lab? And so I approached Karen and Lindsay with the idea of, hey, could we do a session on academic faculty positions? And so out of that, we have put together what I think is going to be a really great panel to talk about this. So we're going to allow everyone to introduce themselves, but I do want to thank Karen and Lindsay and Mark and David for participating today and sharing their expertise and wisdom and guidance with all of this. Our overall goals for today's sessions are really to raise awareness of the different types of positions that are available to folks. So we're going to talk about both tenure track and non-tenure track faculty positions and what does that really mean. We want to try to help you start the process of understanding what are some of the pros and cons of those different positions. That's where we really want to hear from you though, right? So some people shared questions in the registration. I'm going to encourage everybody to go ahead and share questions in the chat. If you want to share those to everyone, you can put it that way. If you want to send them directly to me because you want to ask a question, but you don't want to necessarily be known as the person who asked that question, you can do that and we will ask that question in an anonymous way. I will compile those kind of as we go through the session. So as people are talking, if there are questions that pop up, go ahead and put those into the chat at that time. I will collect them and we will get through them once we get to the Q&A session. And then at the end of all of this, one of our goals is really to help encourage all of the trainees, all the folks that are here today, to become intentional about your academic career goals and decide, what is the direction that you want to head. And once you have a better sense that, yep, that's the one that really appeals to me most, understand how do you start preparing for that and what are the things that it's going to take. And so I think, one of the things I get concerned by oftentimes is that when you listen to the national conversation, it's faculty positions are so hard to get. It's super competitive. You better start planning for doing something else. And I think it's really important to understand that you have a lot of options. But the more important message for me is understand that, no, I really do want that faculty career. That is exactly what I want to do. And once you have that sense of resolve, then you need to understand what is it going to take to achieve that goal. So at the end of this, we really do hope that everyone who's here today has a better sense for what kind of options are out there and have some connections of people who can give you more advice and experience and guidance on pursuing some of that. Okay, so to start, I will continue just talking before I hand it off. We're just going to do a quick little introduction of who we are or who the panelists are, who I am as the facilitator, and our own experiences within academia. So I have a PhD in pharmacology from CU Anschutz. During my PhD work, the only thing that I realized is that I actually was more interested in a faculty career that had teaching as part of it. I didn't like being in a R1 environment or in a med school environment. I missed undergrads. And so for that, I did a postdoc on the Denver campus that allowed me to get some teaching experience at the same time. Through that, I did all the kinds of things that I thought I needed to do to kind of prepare for faculty career. I did teaching, research, did service in the department. At the end of my postdoc, I was a research assistant professor for a couple of years. I actually, even in that role, thinking about it now, it probably wasn't doing the right kinds of things that would have got me promoted in that series. But so I was a research assistant professor for a couple of years in a non-tenure track position. And then in 2016, I moved into a full-time administrative position as a director of the postdoc office. I now actually have a secondary appointment as assistant professor. And so that also raises some interesting questions that I may ask myself for Mark about what those kinds of things, how that process works, given that it's a secondary appointment for some things. So I have, in different ways, tangential relationships to faculty career options, but I'm not formally in that position now. So I think maybe we'll start with our Denver campus folks, and I will turn it to Karen, and then we can just kind of move down the line.
Thanks, Bruce. My name is Karen Sobel, and I direct the Center for Faculty Development and Advancement on the Denver campus, but we serve both campuses, Denver and Anschutz Medical Campus. Let's see, my background, my doctorate is in education. However, I was in academic libraries here on the Denver campus for 13 years before moving into this job. And I will say, Bruce was talking a little bit about being embarrassed about your questions, but I have heard every question in the world, and I'm always glad to talk with you about them. I am a tenured associate professor over here on campus as well, so I can share that perspective. Right. Lindsay.
Hey everyone, I'm Lindsay Hamilton. I am currently the director of the Center for Excellence in Teaching and Learning at the Denver campus. I have a unique background in the sense of within academia. I think I've held almost every title we're going to be talking about today in some regards. So I have a PhD in neuroscience from Wake Forest University School of Medicine. I did my postdoc experience at the U.S. Army Medical Institute of Chemical Defense. And then I became a senior scientist as a toxicologist for the US Army for a few years and did so that government side of work. And then I really missed teaching. I love teaching. I was always looking for opportunities at the Army. I volunteered to lead every training I could. So we moved to Colorado and I started as a lecturer, an adjunct faculty member, just teaching a class or two here and there. Then I transitioned into a assistant research professor role, like Bruce mentioned. And again, similar to Bruce, did all the wrong things if I wanted to be promoted on that line. Then I became a senior instructor. Then I skipped a few titles in there and I became an associate professor, clinical teaching track. So now I have an appointment in the psychology department and now I'm directing our Center for Excellence in Teaching and Learning for the entire institution. So I've had a lot of the titles and I can tell you about the pros and cons of all of them. So I'll hand it over to our Anschutz colleagues.
Mark, you want to go first?
Go ahead, David. That's fine.
Okay. I am David Pollack, and I am a full professor here in biochemistry and molecular genetics. Let's see, where did I start out? Yeah, so I got my PhD in biological sciences from Stanford University with a focus on molecular evolution. And then I ended up doing more postdocing than I intended. I got fellowships. So I got this fellowship that sent me to England for a couple of years where I was working at the National Institute for Medical Research, and then back to UC Berkeley for a year. At the end of that, I got my first job as an assistant professor at Louisiana State University, but I deferred it to do a director's fellowship at Los Alamos National Laboratory for a couple of years. So that was actually a really nice opportunity. I call it a pre-sabbatical. Anyway, so I went there for 6 years, and then I came here as a associate professor. Actually, they do it here. It's a temporary associate professor when you move, and then you have to be formally approved by the Tenure and Promotion Committee, which I've been on actually here for. This will be my 4th year now. I've been being for the last 2 years, I've been being the co-chair of the School of Medicine Tenure and Promotion Committee. So yeah, full professor, and I'm a member of multiple graduate programs, which is an important part of being in a research department here. So I'm in the computational bioscience, the genetics and genomics program, and the structure and biochemistry graduate programs to get students.
And you finished, David? Okay, great. I'm Mark Absug. Good morning. I am the token MD on the panel. I do not have a PhD. I am currently a professor of pediatrics in the subspecialty of infectious diseases. I'm also the vice chair for academic affairs in our department on the Anschutz Medical Campus. My path, I went to medical school at Boston University and then did my pediatric residency at the University of Rochester in New York. I came here for fellowship back in 1985 and have happily stayed on faculty since and have risen through the ranks of assistant to associate professor and then finally full professor and subsequently with tenure. And I have done and continue to do a mix of clinical work, meaning patient care, teaching and research. And that research has at various times both been in the laboratory and more recently in the clinical realm. And then since 2013, I have helped to lead our academic affairs office in our department, guiding our fellows and faculty and new recruits to our institution through the trials and tribulations of academic advancement. So I'll stop there and turn it back to Bruce.
Thank you, Mark. And we are very happy to have you, even though you're an MD. We appreciate that. I thank you. It is really great. I will say for folks, you know, one of the things that for both Mark and David, when they are representing things from, you know, faculty perspectives, things like that, that is going to be within the School of Medicine. And so it's important to keep in mind that different schools and colleges may have different rules. There are going to be some similarities across the institution, but in terms of tenure and promotion, things like that, that will vary depending on where you're located. So as everybody knows, you know, 80% of or 85% of our postdocs are School of Medicine postdocs. Majority of our PhD students are School of Medicine. So if you're thinking about a medical school environment, this is probably going to be pretty representative of that. And so it's really nice to have Mark's expertise and viewpoint from there. So happy to have you. Okay, so the next step in this is we just want to provide some information. Again, as we go through this, we encourage you to think about what kind of questions are popping up for you so we can address those when we get into the discussion section. But Karen and Lindsay are going to give us a little bit of an overview of different types of institutions, because I think that's another area that we don't always appreciate. Well, what does it mean to be an R1 institution, and what's different, say, between a primarily undergraduate institution versus a medical school campus? So I'll turn it over to them.
Okay. Thanks, Bruce. Let me give you just a tiny bit of background on the Carnegie classification system, and I have my little cheat sheet here. So Carnegie classifications are a method for officially classifying institutions of higher education in ways that tell you a number of things in a very compact manner. They usually assign a letter and then a number to each institution. So they tell you a little bit about how high the research output or expectation is for faculty, the highest degrees offered by the institution. So do they have doctoral students, all undergrads, and so forth. They tell you a little bit about the setting as well, urban institutions versus college towns and so forth. And then you'll see references to the Carnegie basic classification in little hand quotes, which focuses mostly on the amount of research conducted and the degrees offered again. And that is where you may have heard the famous term R1 institution. Now, Lindsay's going to tell us a little bit about some of the more common classes of Carnegie classification.
Sure. And I have a handy dandy PowerPoint. I always like a good visual aid. So I'll go ahead and share that. So like Karen mentioned, Carnegie classifications, very commonly used. There are 7 classifications. We typically only talk about kind of the top ones, mainly when we're talking about these types of faculty positions, but there are a lot of them. Doctoral universities can be classified as R1, 2, or 3. So R1 is your highest research activity. So that's Anschutz Medical Campus is an R1. And it's based again on that total research and development expenditures, the number of doctoral degrees that are being conferred, and kind of per capita, like what each faculty member is kind of bringing in and researching research dollars. I thought I'd just share some of that classification for some local institutions so we can just see what maybe some of the differences might look like. So the University of Colorado Denver Anschutz Medical Campus were kind of combined in our classification as R1, doctoral universities, very high research. The undergrad instructional program, they classify it as balanced. So there's arts and sciences, there's a lot of that. The graduate instructional program is classified mainly as STEM dominant, meaning most of our doctoral programs are in the STEM fields. Enrollment profile is going to be majority undergraduate. And that undergrad profile, it also gives you that information. So for our undergraduates, medium full-time, it is selective. We have a high transfer population. So these are things you can look up about any institution. It'll give you all this information on an institution of what it looks like, what's the size, the setting. We're a large, primarily non-residential campus, and it's a public institution. Here's Metropolitan State University. So it's also public, it's also large, primarily non-residential, but its classification, main classification is going to be a master's college or university. They don't have the same sort of doctoral degrees. So it kind of starts to give you that difference in what it looks like. University of Denver is a doctoral university, R1, high research activity. The graduate instructional program, it's a comprehensive program, but there is no medical or vet school. And you can see that it's lower transfer rates than the other ones we've seen. It's smaller than the other two we've compared to, and it's a private institution. So you start to get all these details about an institution when you look up the Carnegie classification for them and what it looks like. And this will tell you a little bit about some of the expectations for faculty, depending on what the institution's characteristics are. High research activity places are going to have high research expectations for faculty. Lower research activity institutions are going to have lower research expectations. Okay, I think I'll stop there. Oh, I had Regis on here as well, but I'll pause.
Yeah, so I think actually that just moves right into the next, the setup for what are the different types of institutions, but then thinking about an institution like CU Denver, what are the different types of positions then that exist in that environment?
There you go. So I'll let Karen go ahead and do a quick overview since that's your expertise, Karen.
Well, I'd actually put together some notes on the tenured and tenure track ranks in particular. So I'll hit those and then I'll pass it over to you, Lindsay. So let me talk a little bit about the tenured and tenure track ranks on the Denver campus. And we have kind of classic academic ranks over here. So most of our research is not in the clinic and so forth. And like Lindsay said, we have, and like she's showing on the screen, we have quite a number of ranks on the Denver campus. And I would break them into 3 groups, just like Lindsay has: tenured and tenure track, full-time IRC, and IRC is instructional, research, and clinical ranks. And then part-time IRC ranks, so lecturers who may come in and teach a couple of courses per semester. Let's see, so I'll tell you a little bit about expectations for tenured and tenure track ranks. Typically, you're hired as an assistant professor. You work for about 6 years, submit a dossier for tenure and promotion, and then you go up for associate professor. And if your dossier and your case successfully pass, you are granted tenure and promotion at the same time. So you become an associate professor and you become tenured here. And I know that's a little bit different on Anschutz Medical Campus, which we discovered as we were putting this together. Let's see. On the Denver campus, a tenured position is basically permanent. I mean, you can, unless you do something egregious, you have it permanently. Let's see, many faculty on our campus do end up staying at the associate professor rank. However, some do work for about 6 to 10 more years, and they put in another dossier to be promoted to full professor. And that gives you some more opportunities professionally and so forth. We'll talk a little bit more about what tenure means in later sections of the presentation. But I did want to say most of these tenured and tenure track positions on our campus are evaluated 40% in terms of research, 40% in terms of teaching, and then 20% in terms of service to the university, the profession, the community, and so forth. That doesn't perfectly reflect how your time is allocated, though. It's just your evaluation. So let me pass it over to Lindsay now.
So I'll talk a little bit about the IRC ranks. So IRC stands for Instructional, Research, and Clinical faculty titles. All of the IRC ranks are not tenure track lines. So it is not a permanent job, like Karen mentioned. However, I would say the majority of our faculty in these lines have been with the institution on average for 10 plus years. Looking at our notes. So it is essentially, these are long-term positions as well. So clinical teaching track is the title our campus, the Denver campus uses for people who primarily teach. I have to tell you, the majority of them are not clinical in any way, shape, or form. It's kind of a holdover title from more medical campuses where someone in a clinical track might be doing more clinical work. For example, I am a clinical teaching track faculty member in the psych department. So sometimes people think that means I practice clinically, and I do not. I'm a neuroscientist, not a clinical psychologist. CTT lines, you usually start as an assistant professor, like Karen mentioned. You come in at that role, at that level, and then you put in a dossier anywhere between 3 to 5 years, typically at the assistant role, to move up to the associate. And then again, 5 more years or so, you could go on to become the full professor CTT. You do not get tenure with those promotions, but there is salary increases and the breakdown is typically for CTT faculty, the minimum is 51% teaching, meaning 51% of your evaluation is on teaching. And then there's usually for CTT lines a research component as well, anywhere from 10 to 30% of your time, and service as well. There are research professor lines, and again, same kind of level, assistant to associate to full for research professor. The majority of your time as a research professor is going to be in research. And that is where the title comes in. There might be teaching associated with it, and there would be service too, but the bulk of the time will be research. And then there's also instructor and then senior instructor. The campus is actually working on having a extra title thrown in there at that level so that every position would have the 3 ranks, but currently there's only 2. Instructors and senior instructors, 80% or more of their time is teaching. And very minimal. Usually instructors do not have any research component in their evaluation. And then part-time IRC ranks, we have lecturers. So these are what we sometimes refer to as adjunct faculty. They typically teach 1 or 2 classes a semester, and it is a semester by semester contract. So the full-time IRC ranks, all the ones listed under there, it will be at least a 1-year contract position, but we now have 3-year contract positions for those roles as well. IRC part-time, the lecturers would be semester by semester. So I'll stop there.
Okay, so thank you very much. Again, I'm hoping that there are kind of questions that people are starting to have. And so again, perfect, we got one in the chat, so I'll keep recording those. So think about those and add them in, but then we also want to hear now from Mark and David. So how is this similar and how is this different on the Anschutz campus, especially since we are presumably one institution?
Yeah, so
go ahead.
You want to go?
No, go ahead. That's fine.
Either way, I went first last time. You go this time.
Okay. We have actually, Lindsay, do you want to just keep your slide up for a minute? Because it may be helpful for the comparing and contrasting.
No, happy to. I'll put it up.
Thank you. So I don't have slides, but we have what are called series on our campus, and there are 3 of them. They're called the regular faculty series, which is probably most equivalent to the tenured or tenure track ranks that you see on the slide.
Oh no, I think he froze up.
Mark, yeah, Mark looks entirely frozen. Why don't I
That'd
start
be great.
going for him? Lindsay, if you could give up the shared screen, I do have just a similar sort of slide prepared. And let's go here. I'll now put up this. Yeah, okay, Mark, if you come back on, just yell. So as Mark was, whoops, those are just notes. As Mark was starting to say, sort of our structure at the medical school, it's similar and yet different than the downtown campus. I'll say from our point of view, the idea that we're one campus is kind of an administrative fiction. So I wouldn't pay much attention to that. We really do operate in completely separate ways. I threw up a link here and I put this in the chat if anybody wants it. But I would really recommend, if you're looking at these things, that you dive into this and you dive into all the sub links and things like that to this. Because what you really want to do is not be in the position that others have already talked about, where you're working hard and working away, but you're not really working towards the correct goals. So Mark can yell if he's back, but
I am back, but go ahead. Sorry about that.
So yeah, so maybe what I'll do, I actually put this up for the School of Medicine, which I think is what you are starting to talk about. So this is specific to that. And I think you were starting to say is that basically I put tenure track. It's hard not to say tenure track, even though Mark is correct that these are all series. So this would be the regular series that I have here where it says tenure track. And you have the research series and the clinical series, and those 3 things are also doing similar to what Lindsay said, where you have you start out as an assistant, you get promoted to an associate, and you get and then potentially promoted to professor. And the tenure is a separate thing. So whether you're tenured or not is a separate thing. And only the regular series, which is not the research series and not the clinical series, only the regular series is eligible for tenure. So that doesn't mean though that you can't be in one of these series and go for tenure. You're just going to have to move to the regular track and fulfill the requirements for the regular track in order to then be eligible for tenure. So there is the possibility of movement between these series depending upon what you're able to do. I wanted to emphasize a few things. I don't know we talked about as much, but there's certainly a question. There's sort of different questions at different levels of these different things, but you're generally focusing on teaching, research, scholarship, and service. And I left off clinical from here because I figured Mark was going to do the clinical, but that's another category there. And then you have the question about whether you're meritorious or excellent in the research and teaching or the clinical. And you have the questions of regional, national, and international reputations. So we can talk a little bit later, maybe in the questions about how you get those different things. But you really, really need to focus on what are the specific criteria. So here we have these things called matrices, which which are they can kind of grind you down at first, but they're basically a list of examples of things that would qualify you as meritorious or qualify you as excellent in some category or other. And those are your starting guide that you're going to have to make an argument when you go up for promotion or tenure that you are qualified at that level in those categories. Don't get scared by the entire list. There's not saying that you have to do all of these, and that's a little bit of, you should be talking with your mentors and things about how much is enough. And that's always a tricky question, but there's a lot of examples of the types of things that you should do. If I wanted to give an example in teaching, you have to get excellence in teaching. Basically you have to do some sort of leadership position in teaching. You're developing a course, you're developing materials, and you're guiding something at a higher level than just doing a few lectures in a course. So one thing I want to throw out there is focusing on this instructor or senior instructor versus the research series. So the research series, true to its name, focuses mostly on research. So you're not worrying about teaching, for example, in the research series, but it's still something you have to go up for promotion to associate professor after you're in your 7th year as in a service as an assistant research professor. So a lot of these things say, talk about at rank, and that means what matters is how long have you been at that rank as assistant research professor. So for example, if you're a senior instructor and you say, I'm going to go for it, I want to be called a professor and I want to be in the research professor series, you're going to have 7 years from that mark when you began as that assistant research professor. I also want to point out here, just because we use the words instructor and senior instructor, but we use them in a very different way. And I think they have very different meanings than they do at the downtown campus. So at the downtown campus, I think Lindsay said they're mostly about being part-time, and there's a lot of issues with that. Here, senior instructor and senior instructor basically are their roles to go into after being a postdoc, where essentially you can get paid more and you have the potential to do teaching and add teaching to your resume at the school. So that's a big thing. But the other thing about all of these is the question about how are you getting paid, and that can differ radically between the basic research departments and the clinical research departments that Mark can talk about. But a lot of these positions, particularly instructor and senior instructor, are generally you're being paid off of somebody's grant funds. So you're being paid in that laboratory and you're an at-will employee. So if they run out of funds, that can be the end of your job. So you're highly dependent on that relationship with your whoever the PI is who's bringing in the grants. And I guess the last thing I just want to point out that's really quite important is that if you're moving into this assistant research professor position, you're really expected to indicate or to demonstrate a degree of independence that is an independent research contribution relative to the PI or the lab that you're in. And that's a tricky thing to say what that is and how to do it. We can go into that in questions and answers, but that's a really important thing to think about if you're thinking about that track. All right, Mark, do you want me to leave this up and I'll
Yeah, let me just add a few things. Thank you. And I'm sorry that my internet seems to be unstable, so I hope I will stay on. David, you want to just, the slide you were just working on, I'll just expand on a couple of points. One is that at the School of Medicine, tenure is primarily based on teaching contribution and research or scholarly accomplishment. So that is why folks in the regular series, or what David has termed here the tenure track, are the only folks that are available or are eligible for tenure, is because that's the only group for which both teaching and scholarly work is really assessed during the promotion process. In our research series, as David mentioned, teaching is not particularly emphasized. And in our clinical series, scholarly work is not emphasized. That's the reason faculty in those series are not tenure eligible. The other point to make about the research professor series is that in addition to teaching not being an absolute requirement, or at least not being particularly emphasized, is that faculty in the research professor series may or may not be independent investigators. They may be, or they may be collaborators, contributors to a lab's research. They may or may not be PIs on grants. Whereas if you're in the regular series with a research emphasis, it is more expected that you'll either be an independent investigator or that you'll be an independent contributor to a collaborative research group. And I'm happy to answer any questions about that. And if it isn't clear, also, I'll just mention that the instructor and senior instructor ranks are not in a promotion pathway. So the faculty who have the rank of instructor or senior instructor are not required to go up for promotion. There is no time clock. They can be instructor or senior instructor theoretically for their entire career, but they can move into a promotion track by becoming an assistant professor if their job description and job activities are consistent with their becoming promotable. So I can stop there. Turn it back to Bruce.
Okay, so this is great. There's been a lot of information, and there have been some good questions that have come in that I think feed into some of the questions we're planning on addressing as well. So I want to start with this one question that came in, which is, what position level rank should a postdoc aim for with their next progression? And is tenure track after a postdoc unrealistic? And so I think starting with David and Mark, and then we'll push that to Lindsay and Karen too.
I would say that not at all. I mean, I went into a tenure track position from a postdoc, and that's certainly a path that a lot of people take, and it's a path that's fairly tried and true, I would say. Perhaps the main path. And the reason for that, and I would really go into looking at those promotion criteria. And so you basically need to have a research program going. So it's expected that after postdocs, that you'll have the ability to build that research program, and then coming in as an assistant professor, that you'll be able to continue to build that program more independently from your previous advisors, and that you will be able to get your own grants to do that building program. So that continuing to publish papers and getting the grants so you can build your personal research program is really central to getting that promotion. So the question is, can you get yourself to the point where you're competitive for that job, and you're going to be competitive to build your independent research program? And that's probably the fundamental thing. The question, is just, well, were you able to do that from your postdocs? And your postdocs are probably your best opportunity to do that, because you can be really almost entirely focused on research during your postdocs, and you don't have the distractions that may come with many of these other positions. So many of them may come with duties and even an entire focus on completely other things than building your research program and building your research ideas.
I'll add just a couple of points to what David has said. One is that which series a faculty member is appointed to, that is the regular series or tenure track, or the research series, or in the case of a clinical department, the clinical practice series, really depends on the job description that individual is going to fill. So if there is a significant teaching component and the expectation of independence in research, then that person is put in the regular series. If it really will be a collaborative research role without significant, particularly didactic teaching responsibilities, then the research professor series. And the way, at least in our clinical department, we use the rank of instructor as compared to assistant professor is what David alluded to, is the time clock issue. If a faculty member who's heavily research focused is able to come in and that research program is ready to roll from day one, then that individual will likely start as an assistant professor. If, on the other hand, it's felt that a year or two to help establish the research program, get some funding, get some more data for initial publications is needed, then we will usually start as an instructor or a senior instructor, give that person a year or two before the pressure of the 7-year time clock starts. So Karen put in the chat, do many AMC faculty move from instructor or senior instructor to the assistant professor rank? For those kind of faculty where they're research intensive, that they start as an instructor, the expectation is yes, they would start as an instructor. After a year or two, when things are established, they would then move to become assistant professor. In our clinical departments, we also use the title of instructor in a totally different way. And those are some faculty that we have that are almost all clinically based, seeing patients day in, day out, a little bit of teaching in the clinical setting, but they're really not doing the kinds of things that are consistent with being promoted by our promotion criteria. They may be instructors or senior instructors for their entire careers, but that's really a different way that the clinical departments may use the instructor rank.
Yeah, I'm just going to throw out, can I just throw out, just in contrast to the clinical departments, I think it's relatively rare for us to view the instructor as a route to the regular faculty series. It is a route. I mean, it's possible to be a route, but people are generally not hired in on that as part of that route. So usually I would say we use instructors as you've got somebody's got somebody in their lab who's a postdoc and they're really good. They want to stay, the PI wants them to stay, and they need to be, I mean, essentially they need to be promoted at some point and not be a postdoc for the rest of their lives. And so that's more of a position that could be filled and moved into in that way. Although there are cases for sure where people do it. I just would say it's not as regular a pathway as you described.
And David, can I ask you, what determines in that circumstance whether an individual is hired as an instructor or hired in the research professor series, perhaps as an assistant professor?
Oh, you muted yourself, David.
Sorry, I clicked on the wrong way. Yeah, I would say the research assistant professor series is usually based upon the individual and their willingness. So we do have a criterion that even if you're working in somebody's lab and you may not be getting grants on your own, but you do have to establish independence of research contributions from your PI, and you have that time clock. So, there's a potential that you can, get that you're in a position where you can get more money, but that's going to depend on negotiations with the person who's bringing in the grants. And it's mostly a matter of the interest of the person involved, whether they'd rather be an instructor and not deal with the research track, or they like the title of research professor and they want that as part of their CV.
So you're using instructor as even one level less of independence.
Yeah, absolutely. I mean, it certainly, as you say, it's not a, I forget what you said. It's not promote, your promotion is not due to outside committees. It's basically due to the person you're working with. And so it's a different level. I mean, in the School of Medicine Promotions Committee, we will look at your promotion. We have a committee, a big committee of people, and we will look and vote on your promotion to associate professor. Whereas if you're an instructor, going from instructor to senior instructor, for example, there will not be a School of Medicine committee that will approve that, or we'll see how you're doing.
I wanted to add something, if I could, to the conversation. And I think you need to be intentional about what do you want your career to look like? What do you want to do? And different institutions, every institution, it's going to look a little different. And one thing we haven't talked about, we're mainly talking about R1 institutions here and the different titles, but you could work for a PUI, a primarily undergrad institution. And that's going to look very different. And they have tenure lines, but there'll be a larger teaching component. I'm going to share my screen again, which I think will help clarify some of the questions I see coming in the chat too, which is, what is it that a professor or a faculty member does? We keep using these terms, research, teaching, service, and the percentage. This is just to give you a huge overview of the different types of things, and the percentage will slide depending on the institution and the title roles. So is it realistic to go from a postdoc to a tenure line? It could be if you've established independent research and you're ready to go for that. But a different institution is going to be looking for different things. Like Anschutz Medical Campus might be looking for very different level of research and independence than a primarily undergraduate institution, which is going to be more interested in your research and how you can do that with undergrads versus doing it with a team of grad students and postdocs. And so it's how you present it and share it. So this is when I know there was a question in the chat, like, what is service? What are we talking about there? It can be lots of different things. It's considered committee work and all these types of things. And so any institution, any position you're looking for, you're going to kind of want to see that breakdown of what's the expectation. Is it 40, 40, 20 teaching, research, service? Is it 80 research, 10 teaching, 10 service? What is that breakdown? Because that will indicate to you too what the institution is looking for in job applicants, in what types of things to focus on in your application.
So I want to jump in because I think there's a good question here that kind of gets with some of the things people are asking about too, and then gets a little bit, I think, differently between how people may be hired into instructor positions in a clinical setting versus instructor positions in a research setting. And so my question, and Karen, I'm going to pose this to you first, and then I want to hear also from Mark and David, but in terms of getting approval to create a position, what are those steps between approval to create a tenure track position versus steps that it may take to create an instructor position or a research assistant professor position? One of the questions that has come in is, who approves appointment in one and movement to the other? But before we even get there, what are the steps that it takes for a department to create a tenure track position and versus creating an instructor position? So Karen, would you comment on that first?
I have to say, I don't have a great answer for you, Bruce. I know for tenure track positions, I'm quite familiar with doing that. There has to be what we call a tenure line open. So your department has a certain number of tenure track positions that are kind of pre-approved. There has to be one available. Funding has to be available. You have to be able to guarantee the funding over a long period of time. I'm not sure how that varies for instructor positions. I've not helped hire for one. How about you, Lindsay? Have you done that on the Denver campus?
Yes.
Awesome.
Anything minus the tenure line is going to be easier to establish, but it still has to be established, meaning departments have to make requests to their school or college, and sometimes at the university level at itself, to say, we have a need for this, and so we need to create this new position, this new line. Whether that's an instructor or an assistant research professor or a clinical teaching track, whatever it might be. Because the tenure line, once you have tenure is basically a guaranteed position, that funding has to be much, go through a different level of review. So it takes more to establish a tenure line because the university is committing to paying for that person for a very long period of time. Whereas the other lines are easier to establish because if it's a 1 year or a 3 year line, they could potentially remove the position at some point. So I can give you an example, like in the Denver campus, I'll just use my own department, psychology. We saw a huge increase in student credit hours, like students taking psychology courses from us over the last 2 years, like through the pandemic. So because of that, we put in a request and established 2 more full-time instructor lines because we need people to teach the courses if we have so many more students. So you put in some evidence of why the department or the program needs the position, and then they can create it.
Yeah, I would agree with that. At most institutions I've been with this, it's all going to be a conversation with the dean, probably between the chair and the dean about whether it can be approved, but the dean's not really going to care that much about a non-tenure track line because the dean is making no commitment for a non-tenure track position to pay for that line. So that's a huge difference from the perspective of do they want to do this. I will say too that at some institutions, it's not the way it works here, but at many academic institutions, a tenure track line it's a coveted thing and it's hard to change. So when a department will sort of think that they own lines, and when somebody retires or dies, then okay, that opens up a new line and they'll hold on to it. And this may be sometimes, and you got to look at this in job ads where you might see something like, a professor and, we're looking for a professor in, I don't know, something really old, like plant morphology or something, I don't know, something like that will be like, well, that line might have been established 50 years ago or 80 years ago. And they're keeping hold of that line and they're going to have to advertise it like that. But then they'll say in the details, of course, they're interested in somebody who's doing modern research techniques that didn't exist when that line was established. But that can vary from place to place, but oftentimes it's a really, really difficult thing. It can vary from a really, really difficult thing to a conversation with the dean, and the dean's deciding from his budget whether he's going to commit that money.
And this is probably as good a place as any to mention that what tenure means can vary with the institution and can vary with the campus within the institution. So that on our campus, particularly in clinical departments, tenure means something quite different than certainly on the downtown campus. On our campus, tenure is not a guarantee of full salary. It only guarantees a portion of one's salary. And at least again,
oh no, we've lost him again, but he was saying good thing.
Well, I think good thing depends on your perspective, right? One of the things that we had talked about. Important things that are important to know. The things are important to know. So one of those differences, Karen, you want to go ahead?
I was just going to jump in and say what tenure means on the Denver campus. Is that cool?
Yeah, so
in clinical departments.
I'll try to finish Mark's thought too. That's very frustrating. I feel bad for him. That there's nothing more irritating than bad connections. One of the things he was saying though is that on the Anschutz campus, tenure and promotion are dissociated. So you can go through the promotion process and there's a promotion clock from assistant to associate to full, but those aren't locked together with the tenure process. And so tenure is a different set of criteria. And so we have a number of full professors on our campus who actually aren't tenured, even though they have ascended to the rank of full professor. And that's different than other institutions. And one of the other things, one of the other things I think is that tenure doesn't guarantee as much of your salary at the Anschutz campus as it does on the Denver campus. So I believe my memory is correct that this is one of the things we talked about, where it's, you know, a third, 2/3, maybe half of your salary. Well, we got a little feedback.
Mark, I think that's from you.
Okay, are you called in, Mark?
I am. I'm so sorry for the challenge.
That is okay. So I'll hand it back to you quickly. So what does tenure actually guarantee for someone at Anschutz?
So at Anschutz, the primary guarantee of tenure is that, you know, unless you do something really awful in your position, that your position is guaranteed. But as far as that guarantee, that is basically the shell of your position is guaranteed. The piece of money that is guaranteed is what's called the base component of your salary. And the way Anschutz has structured salaries for now, gosh, maybe the last 20 years, is we all are assigned a base component and a supplement component. And the base component is usually less than 50% of the salary, and that's the piece that's tied to tenure. So it generally is less than any of us would like for the work that we do, which is why tenure is much less of a financial guarantee on the Anschutz campus, and really in many ways comes down to an honor rather than an issue of guaranteed salary and position. And perhaps for that reason, only a portion of our faculty in the tenure track, a modest portion, actually ever go on to seek and get awarded tenure.
Yeah, I'll say the sense is that the School of Medicine has really tried to not downplay tenure, but make it more rare to get tenure. And our tenure criteria are probably amongst the strongest in the nation in terms of you know, what it takes to get it. So for example, it's much more difficult to get tenure here than it is, say, at Boulder, or I think the downtown campus, or most other undergraduate institutions.
And rarely on our campus is it awarded at the associate professor level, occasionally, but that's the exception rather than the rule. Usually it's either with or subsequent to promotion to professor.
Yeah, you're expecting to be operating in the truly outstanding level, and most people will need to go up for associate professor before they have the CV basically to be awarded tenure.
I'll provide a couple of perspectives from the Denver campus, again, on that kind of traditional academic side. Tenure here does generally guarantee full salary, so the university is typically covering your entire salary. A tenured job is kind of technically a forever job here, although, you know, many people do not end up staying here their entire career once they're tenured. You can often do what we call taking your tenure elsewhere in an academic position. So if you're seeking a position elsewhere, you can often apply to be tenured upon your hire at another institution, and that typically works out. I'll also say there is frequently the myth among academic positions that everything's easy once you are tenured. That is not true. I would not say that the expectation overall goes downward, but I would say that you can, yeah, I see David making faces to agree with me, but you can work on kind of a different schedule. So I've found over time that you can take on research projects where, you know, your yearly output may be a little bit up and down, but overall you have more freedom to work on a larger project on your schedule. Back to you, Bruce.
Yeah, thank you, Karen, for that. And Lindsay brought up a point that I think is going to be important to talk about now too. And so sometimes we hear, and just to put a fine point on it, what do we really mean when we talk about this? But the difference between hard money and soft money, and how that factors into some of these different positions. And I think this also ties into some of the earlier conversation about how are these positions created? Because if we're talking about a tenure track position, there will be some kind of hard money associated with that. Whereas if you're creating a position like an instructor position, research assistant professor, that could be a 100% soft money type position. So Lindsay, do you want to just start some of that conversation?
Sure, be happy to. So what is hard money? What is soft money? Let's just start with that. Hard money is what we refer to when we say it's guaranteed money. It's the salary you're going to get no matter what, whether you have a grant or not, that's the amount. Soft money is money that's going to come from grants and under other funding places to provide support for your position. So for example, on our campus, like when we received a large training grant from the NIH for the institution, we were able to use that soft money from the grant to hire 2 assistant research professors to work on things related to that. So all the money from that was soft money coming from the grant. The more hard money in your contract, that's a guarantee. So the more hard money that's going to be in place, the harder it is going to be to create that line because it is guaranteed funding. Soft money positions, full soft money positions are easier to create those lines because the funding is usually already in place for them. Different institutions will have a different percentage of how much of your salary is hard or soft. And this is one place where, like at R1 institutions, typically, like you were saying, David, some of the salary is going to be hard money, but it's probably a smaller percentage than any of us want it to be. And the rest of it you bring in through your research and your grants that way. But it does mean if you're really successful at bringing in grants and money, you can boost your salary quite a bit. Whereas on the Denver campus, we're more hard money positions and you cannot. So even if I got 5 grants next year, my salary is not changing. It doesn't matter. It's not going to go up. It's just the hard money that's associated with it.
It's probably worth mentioning about summer salary and teaching buyout. So I'm not sure how, it may depend on your department, how you do teaching buyout on the downtown campus, I believe. But at many institutions, those sort of hard money positions where you're getting 9 months of salary where you're mostly expected to do teaching for that. And then if you can bring in grants, you can get summer salary, as it's usually called. So you can basically boost your salary by 1/3 if you get the extra grant money in that case. But if those grants go away, that'll disappear. And you can also potentially get, and this will depend where you are, is you have a certain teaching expectations depending on where you are. And that's actually a really key thing that's wildly different between different types of institutions, is how much teaching they actually expect you to do, how many courses they expect you to do, given your position, given your 9-month position. But at some places you can get a grant and essentially buy out your teaching. So you generally can't buy out all your teaching, and that would be generally bad for your career if you did. But you can basically get that grant money and apply it so you can do research instead of teaching and build your research portfolio. Does that match your all expectations?
Yeah, so one of the things I would add here, and then I'll give obviously Karen and Lindsay a chance to comment too, but within the institution, we have a difference between 9-month faculty appointments and 12-month faculty appointments. And I think to what David was just saying, that can be, I believe most faculty on the Denver campus are 9-month faculty appointments. And so that's where summer would not be covered. So there was a question about salary, and that's one of those things that if anybody wanted to comment on it, I'll let you, but that's an important consideration when you're evaluating a salary, if it's 9-month versus 12-month, because if it's a 9-month salary, then that is actually, there's 3 months where there is no additional salary. So you got to adjust it by that when you're comparing. It's not necessarily apples to apples if it's the same salary at a 12-month institution. But yeah, Karen and Lindsay, if you want to add anything to that.
I'm not afraid to comment on salary. I know it's maybe a little taboo. David, you're absolutely right. Salaries are going to be higher at med school and at R1 type institutions. Medical campuses are always going to be higher generally than primarily undergraduate institutions and things of that nature. And then tenure track lines, it's a higher salary than the IRC faculty lines. It's just flat out because of what you come in at. So if that's the main component driving you, then tenure track would be a higher salary overall. Clinical teaching track is probably the highest salary of the IRC lines because it does have the most mix of the research, teaching, and service component compared to the other ones. Quite frankly, teaching, the more teaching there is, probably the less the salary is going to be. Unfortunately, I say that as someone who thinks teaching is way undervalued, but that is the hard truth to it.
Sure. Yeah, and I'll just add that something we see on the Denver campus quite a bit is faculty taking on some additional summer courses to earn some money and, you know, build up some more teaching experience. I'm always in a small group of 12-month faculty here on campus. So if anybody wants to talk about 12-month positions, I'm glad to talk about them. I would say one of the big differences is just that we have a more traditional expectation for, you know, requesting leave and so forth, and talking with your supervisor when you want to take vacation, compared to a lot of other 9-month faculty who just kind of handle, you know, when they're on campus and when they go away in the summer without really having to talk with anyone about it.
So yeah, I will just quickly, so there is a different benefit structure for 9-month versus 12-month. And so leave is part of that package. So when you actually get into the weeds for this, there's a lot to it. I do want to shift a little bit here as we're you know, about 20 minutes left in the session, because there's some questions about how do you actually then become competitive for these positions. And so I want to have a little more of that conversation. And two things that I'll ask. One was a question that came in, which is what comprises evidence of a research program for applying for a tenure track position? Is it papers? Is it grants? You know, what does that really mean? And then to a comment that was made earlier about it may be difficult to use something like an instructor, assistant research professor position as a stepping stone to a tenure track position. Does that hold true if you're applying to a different institution or trying to stay at your own institution? So is that something that could be useful going into building that competitive research program? So I'd like to start with David and Mark on that one, but then I want to flip it back to if someone's trying to apply for a position, a tenure track position or a CTT position on the Denver campus, what would really make that competitive application? So David, would you, I said a lot, so if you remember what the questions were.
Yeah, so I would view it as, you know, in terms of competing for jobs that are where having an independent research program and being able to get grants, and that usually means being able to get R01s, you know, you're talking about having the ability to convince people that you can do that. So that's the main thing. And a big part of that is paper. So, I mean, if you're coming off a postdoc, I mean, obviously, if you can get postdoctoral fellowships and things like that, and the K awards and that sort of thing, those help you a great deal, but you're not necessarily expected to have gotten a grant already, but you're expected to be able to make the argument that you're in the position to get those grants. So this also brings up something I want to mention. I mean, what do you usually need? I mean, you need the CV with papers on it. Usually you're going to do your application, and a lot of places these days might ask you for 3 to 5 of your most important papers that they'll hopefully at least glance over, and some people on the committee will at least read in a little bit more depth and try to evaluate whether you're really doing impactful research. But you're going to have the chance to do a research statement. Anyway, you may not like all these, but and these days you'll generally also have a teaching statement that you'll have to make, and you'll have a diversity statement. And I would pay attention to all of those. And it would be great to get different comments on what people think those teaching and diversity statements need to be. But I would say the central thing for all three is that you need to provide evidence in those statements of having put a great deal of thought into it. You know, they're not just slapdash. These are really sort of committed thinking about how you're going to do research, how you're going to do teaching, and how you're going to address diversity issues in your own work. And I guess the last thing I would say that sometimes the research statement would be, you know, we'd be looking at that and say, is this a plan? Is this a route to get R01s? So one or more R01 grants. That'll be the primary question. So it's all of this in terms of your pathway. Is that pathway a pathway to get you competitive to do that, to be set up to do your research program? So it's really kind of a matter of what are the other distractions in the job and requirements of the job, and is it going to leave you enough time to do the research component, or is it going to leave you enough time to have the teaching component? So,
and I'll just add, and really it's just another way I think of phrasing what David has stated, is we look for, particularly in a research intensive position, someone who has demonstrated that he or she is not just a cog in a big machine, but has the potential to really come in and establish himself or herself in a independent program, or at least as an independent investigator in a collaborative program, rather than, as I said, just fit in as a piece of a larger research endeavor. We're really looking for someone who is set up to be able to establish a research program, obtain funding, and really be a leader in that area of science.
So Lindsay and Karen, what would you add to that, and what would you change?
Go ahead, Karen, you go first.
Well, I was just going to say there is a lot of overlap. Two things I was thinking about, though, were consistent themes in their research. So the evolution, the trajectory of their research, you can see it getting more and more complex and impactful over time. And the other thing that we often look for that gets tricky can be demonstrating independence from their advisor. So taking on their own research trajectory and so forth, developing their own projects. Lindsay.
I would just add to make your statements and think about those things based on the institution you're applying to. If you're applying to an R1, yeah, you want to have these big research questions and lots of opportunities for big grants that you could be applying for, and know what those grants are that you could be applying for and how you plan to address those types of questions. At a primarily undergraduate institution, your research statement is also going to have to address, how can you do this without grad students or postdocs? So how could you do this, make your research work for an undergrad institution where you probably have more teaching responsibilities than at a different type of institution? You would not put in the same statement, research statement, to an R1 institution and a primarily undergraduate institution. That would be a mistake, because one way or another, one institution would not be happy with the statement in that regard. The other thing I'll just say in relation to all these statements, the research statement, the teaching statement, and a diversity statement, would be that provide evidence. So think back to whenever you took a writing course, maybe last time was freshman year of undergraduate for you, but don't just state something and leave it hanging there. Provide evidence for what you're saying. So if you say, your teaching philosophy is this one thing, I believe in active learning in the classroom, well, back it up. What's an example of that? Even if you hadn't taught yourself, like, for example, when I've had, as a student myself, these types of teaching experiences have been most impactful, and this is what I would try to emulate myself. Give the detail.
So That's great. I really appreciate those perspectives on it. I think that's very helpful. One thing that I'm going to share with everyone here, and I just threw it into the chat. This is available on the CDO website too, but the University of California, San Francisco actually created this tool called the Academic Career Readiness Assessment. So it is a rubric to evaluate where you are in the process for applying to different types of faculty positions. So their goals with this are to help trainees understand where they are in that process, where they may be competitive, but it's also meant for departments when they're hiring faculty. They can actually use that rubric to evaluate criteria. So this, I think, is a really helpful tool if you're trying to dive more into the specifics of those types of positions, and can complement all of the things that the panelists have added for that. Okay, so I think as we're closing in on 10 minutes left or so, we've gotten through most of the questions that are here. There are a couple questions, more nuanced, detailed things about, what does protected time mean, some things like that. But I think, I would like to use the remaining chance we have right now, just to give the panelists a little bit of space to provide whatever advice they would have for someone that's considering a faculty position, regardless of the type, based on your own experiences in the positions that you sit. What would you want someone to know at this stage of their career when they're thinking about wrapping up training and moving into some type of faculty career? Maybe we'll start the way that we began, and so I'll start with Karen and Lindsay, and then go David and Mark for closing.
Oh gosh, I was hoping I had a minute to formulate, Bruce. You can tell me that if this is horrible advice for your setting, right? But I often tell students that, tell graduate students that it may be your second position that's the really fulfilling, dream-worthy one. Often you take a position, your first position, and it's an opportunity to build your research and build your experience and take a little time to look for your real dream job, and know that that's okay. Your first position may be not quite the dream job, but your second position often is. What do you think of that in terms of your setting, Bruce?
So one of the things that I tell people when they're considering faculty positions is that I think it takes a truly exceptional person to call their shot, to say, I don't just want to be a faculty member, I want to be a faculty member at that institution in that department doing that thing. And so I think there's this, especially as you begin, being open and willing to move to where that fit is, where the opportunity is. And then to Karen's point, you don't have to stay there forever, right? If that's a position that allows you to get that foothold to really establish yourself, once you have that done, now you're going to have more opportunities to move for location. So I think, again, be convinced that this is what you want to do because you really love academic research and you love the things that go into being a faculty member, and then go wherever that takes you, right? And know that you can pivot to a different location or a different institution at a later time for that. Again, first convince yourself and be sure that yes, this is indeed the direction I want to head. So that's what I would say to that one. So Lindsay?
I'll just build on that because it's somewhat similar. I think you need to like the parts of your job. If you hate teaching, don't go for a position where you're going to be teaching 50% of the time. That's not what you're interested in. So you really want to find the fit for you. And if you don't know if you like teaching, well, great time to try it out. Find a class that you could support or pop in at, or contact one of us and we'll set you up as a guest lecturer in a class. I'm happy to do that. I teach neuro. Come on in. You can take some of my classes. And then also, there's often a little more freedom, I would say, in some of what we call the IRC lines, the non-tenure track lines, in sense of not to totally call your shot, but to build it out in a way that works more for what you are. I'm a clinical teaching track faculty member. I have a much larger research component in my contract than pretty much anyone else on the Denver campus. And that's because research was important to me and I wanted to keep that in my contract as I moved forward. So yeah, there's always going to be parts of the job, exactly, Karen, that you don't love, but you don't want it to be the bulk of your job that you don't love as you go forward. The other thing is just do your research as you're applying to positions and things. Almost every institution is going to have some sort of center for faculty development, advancement, teaching center, something like that. Go to those websites. You'll often find lots of great information about what those expectations are for the different roles at that institution, since it can vary so widely based on the institutions. So find those websites, find the Center for Faculty Development at whatever position it is you're going to apply for, and then use that to your advantage in building out your application.
Okay.
Could I just throw out there that, don't forget to sort of assess your own life and your needs. So some people might feel like moving around and be happy to, go do a postdoc in Europe or go take a position in Europe and come back and et cetera, and things like that. And some people might, it might be more of a priority to be in the Denver area, for example. And, in which case you're going to be looking for the variety of jobs, but, adjusting some of those, how much do you love your job for how much do you love Denver or something. But life, and you may have partners and things like that, two body problems and things. So, you need to build that into your whole career thing, not just be monolithic about your career and not think about the rest of your life if you want to be happy in the whole thing.
Mark, is there any sage advice, old dog advice that you'd like to provide?
I'll give three pieces of advice. I don't know how sage they are, and really they're overlapping with what everyone's heard already. When you're picking a job, first have an image of what you want to be. Do you want to be a scientist? Do you want to be a teacher? Do you want to be a teacher scientist? And then you want to find, hopefully, the job that closely matches those goals and your self-image. The second point I would make is try to make wise decisions in your job. And by that, I'd say, first of all, your career decisions should be based on your personal fulfillment. If you're going to make decisions solely on whether they're good for promotion, one can predict that you'll end up unhappy. You want to make decisions that will make you satisfied and happy in your position. And then as you do that, secondarily, think about being strategic in terms of promotability, tenure, if that's important to you, et cetera. Just prioritize your success, your happiness first, and then when you're making those decisions, secondarily, figure out how you can make those decisions work towards your being successful, including academic advancement. And then the third recommendation I would say is, hopefully in any position you'll take, you'll be offered some protected time. It's up to you to protect that time. You need to work at making sure that the protected time that you're expected to have is not encroached by things that really shouldn't be encroaching on that time, and that you preserve and maximize the use of that protected time that is part of your job.
So I think that actually was quite sage. So thank you for that. I want to thank all the panelists. That, before I do that though, there's one thing from my own experiences through this process and feelings that I have had in thinking about potential paths to take and things like that I'd like to share too. And everyone wants a level of I'll make that general statement, wants a level of security and stability in their position. And what I want to share is, don't be afraid of soft money. And what I mean by that is, soft money that's the evidence that you're doing your job. If you have a hard money position, but you're not getting grants or you're not getting support that allows you to do your research, you're not going to be successful in that position either. And so just because a position requires that it's soft money, or it requires obtaining extramural funding, things like that, don't let that scare you away if you really enjoy that career. The bigger thing is is to what everyone else has said, identify those things that you really connect with, where you find meaning and purpose in your work, and then worry about the details of that as a secondary piece. So I know for my own position, I have worried about soft money positions and things like that. And soft money positions, if you're successful with the work that you do and you continue, that is something that still can be a path forward. So again, identify what it is that you're most interested in first, and then find those opportunities from there. I'm going to share very quickly here a link to an evaluation for today's session. We would love to get some feedback from you all about what was helpful, what you found good in the session, so that we can, if we do this again, we can make some changes potentially. So I just shared that link. If you would open it now, you don't have to fill it out right this second, but if you would open it now, you'll have it there when we close out the session. Today's session was recorded, and we will be sending out a link to that. I think we also can share the slides from today's session, so we will send those out afterwards as well. With that, I want to give a big thanks to Karen and Lindsay and David and Mark. I really appreciate your time and your collaboration on this project. I think this is an area where we don't do a lot to highlight what really are faculty careers, what are the options that are there. I think today's session was very valuable for providing that information. And so I can't thank you enough for that. And then I want to thank everyone else who came for making time to do this. I mean, the things, talk about protected time as trainees. Part of what you're supposed to be doing is career development. You're supposed to have some protected time for that. This is you actually utilizing that the way that it should. So if you have questions going forward, I'm sure that the panelists would be happy to hear from you and address anything like that. I can include emails when we send out that follow-up email. So again, just a big heartfelt thank you to everyone.
And this is Mark. I just want to apologize for my technical challenges. Hope that wasn't too interfering.
That is okay, Mark. That is, I feel bad for you. I know how frustrating all of that is, and I appreciate your persistence in calling in and coming back. So it was great. So thank you.
Well, you're welcome, Bruce, and I want to thank you for really leading this and organizing us all together into a coherent forum. So very much appreciated.
Well, thank you. Hopefully it was coherent.
And thank you, Bruce, for not calling me and Karen old dogs.
In fairness, I only did that because Mark said it first. So
I embrace it.
Okay. All right. Thank you, everybody. With 1 minute to spare, we're going to close it out right on time. So have a great rest of your day. Have a great weekend. Stay safe. Okay.
Thank you.
Bye.
Bye.
Thank you. Bye.